If you are looking for quality resources about cervical dystonia, I do have a podcast here on YouTube, A Divine Twist. It's got a lot of stories. The intent is to share community resources for people who are navigating the dystonia journey, specifically cervical dystonia. And if you are new to this diagnosis, I would love for you to go and just dive into the resources. It's very supportive to get good information, especially in the beginning. I will be interviewing my favorite doctor on the show. And so I want to ask you, what are your questions? These are the ones that we have submitted so far. What are the risk factors for developing cervical dystonia? How is cervical dystonia diagnosed? Why is it more prevalent in women? What kind of provider is the most appropriate to treat and or diagnose cervical dystonia? What are the most effective treatments for the non-motor symptoms for things like depression and anxiety? Why do most of the treatments for cervical dystonia target the symptoms versus the root cause, which is the brain? Why do you think your patients have such good outcomes? And are there things that you would suggest that a person who's navigating cervical dystonia avoid? Somebody asked, my cervical dystonia spread, if it goes from right neck to left neck and down left chest and left arm after 20 years, is it called segmental, and will it continue to spread? What physical therapist do they recommend now for dystonia? And last but not least, what is functional dystonia and how is that diagnosed? If you have questions that you would like asked, please post them in the comments and would love to see you on the show. Ciao.